You know your day's not going to go well the moment you feel a headache or migraine beginning. If you can't get to your chiropractor right away, what can you do at home to help mitigate, reduce, or prevent a headache or migraine from starting? In this video, I'm going to give you 3 things you can do immediately at home to prevent that dreaded headache from becoming debilitating and ruining your day. Providing you with pain relief strategies and wellness solutions for modern day living. Please click the like button to keep this video handy so you can refer to it the moment a headache or migraine begins. My name is Dr. Jon Saunders. I'm a chiropractor in Newmarket, Ontario, Canada, and I see a lot of patients with neck pain, headaches, and migraines. I have a special interest in seeing patients with neck pain, headaches, and migraines, likely because I used to suffer from migraines myself. I completely understand how they can instantly ruin your day. I know how they can ruin your day either at work, at home with your family, and even socially. The moment you feel a headache or migraine come on, the first thing you're trying to think of is what can you do to prevent it from coming on. Most people want to take medications as a last resort. So instead of reaching for the medication, what can you do at home to try to reduce or prevent or even get rid of a headache? One of the easiest things someone can do, and often overlooked, is to massage large intestine number 4 and acupressure or acupuncture point. This point has been shown to be effective in reducing head pain, jaw pain, face pain, migraines. If you take your hand here, grab your fingers, get to the point of the V, drop into the meaty part of your hand, and what you do is you put some pressure through that part of your hand to stimulate that acupressure point. So what you want to do is you want to just kind of massage the area 10 seconds or so. You want to move back and forth between both hands. Some people will find that it's effective to do the same side of the headache or the opposite side of the headache. I recommend typically to do both sides multiple times a day. It's quite a tender spot when you hit it, so you'll know that you're on it. And you want to just kind of massage the area, relaxed, going back and forth between both hands. And as I say, you can do this multiple times a day. Do it immediately as soon as you start to feel a headache coming on, but it's also good to try to reduce the pain when you actually have a headache or migraine. The second thing you can do at home is look to the neck. Oftentimes, if you're a headache sufferer, you know that pain in the neck ends up in your head, whether it be on one side, both sides, pounding at the front. We typically can feel when our neck is related to our headache. So one of the things you want to do is you want to address the area where most headaches come from the neck, the suboccipital triangle. It's a group of muscles that attach from the lower part of your skull or the occiput, and they attach to the top 2 bones in your neck, your C1 and C2. Oftentimes, when the suboccipital muscles are tight, they get inflamed, they can irritate nearby nerves, and that is what can cause a headache. So the moment you feel some stiffness or tightness in your neck or a headache coming on, you want to address these muscles. One way to address some stiffness or inflammation in the suboccipital triangle or muscles is to do some myofascial or muscular release. It's very simple. You take your 2 fingers, you come off the back of your head, you come off the back of the skull, and get your 2 fingers directly on those 4 muscles. It's very easy. You'll be able to come off the occiput, feel the muscles. You might feel a tender point there. You want to take both fingers, come off those muscles, and we want to extend our neck slightly. And as we apply some pressure slightly up on those muscles, we want to flex forward multiple times. And what you're doing is you are stretching those muscles under an active range of motion, and that can help reduce the tension. Do this 5 to 10 times with forward flexion, but we also want to do it with rotation. 1 hand at a time, off the occiput into the muscles. We're going to put some pressure, and we're going to turn through the range of motion. This one is rotation. And as I say, we're going to do this 5 to 10 times, but we're going to do it on both sides. And then we're going to rotate all the way to the end range while putting a little bit of pressure through those muscles. We're stripping the muscles. It's allowing the muscles to move freely through a full range of motion to help reduce tension. Finally, one other area that is commonly associated with tension type headaches would be our masseter muscle. Our masseter muscle are the muscles that we use to chew. How you find your masseter muscle is to come off the front of the ear, drop down just under the cheekbone, and clench. You can see that muscle when you clench. The belly of the muscle will pop out. That is where you want to be. In order to strip this muscle effectively, drop down onto the belly, clench. You'll find the belly of the muscle. And when you find the belly of the muscle, you want to put a little bit of pressure and you want to slowly open your jaw. You can also drag your fingers down slightly as you're opening to really strip out that muscle. This can be done 5 to 10 times per session, multiple times a day. So there you have it. You can do these 3 things the moment you start to feel a headache or migraine coming on to help reduce, minimize, or even prevent the pain from starting. Please subscribe to our YouTube channel so we can continue to provide valuable content that will help you help yourself in the comfort of your own home. I can't wait to see you on the next video.